Lord Darzi there. Well, listening to that is the Conservative MP Helen Whately, who used to sit on the Health Select Committee and has previously worked in the health sector, and Unite's Assistant General Secretary Gail Cartmel. Welcome to both of you. First of all, because this was done for the IPPR, are any of the parties in your mind ambitious enough with their plans to reform and fund the NHS?
Well, we need to have a combination of both more money put into the NHS, the funding simply isn't enough, but then a plan of what to do with it. And at the moment, none of the parties have put both of those pieces together.
Right. What are you suggesting in terms of major and radical reform with the extra funding?
Well, first off, we think we need a long-term funding settlement for the health service.
Like Jeremy Hunt suggested, the Health Secretary.
Well, he's raised the question, but there hasn't been actually a commitment to do that. So first of all, what is the long-term settlement that the health service needs? But then a plan to spend the money in the right way. One thing that's also clear is that spending more money on the NHS without properly investing in social care isn't going to solve the problems of the health service by itself. And then we also need to understand, how do you make sense of a system that has become incredibly fragmented? So the reforms of recent years, since 2012, have broken up the NHS into such small pieces that it's very, very, very hard for patients to navigate it, for doctors to get to know which other professionals they should be talking to, and we need to make sense of a system that has become really quite out of control.
Right, but that is quite a long-term review, and it has gone through a top-down reorganisation, the NHS. Does it really need another one?
Well, I think it needs some of the problems in the current system to be fixed. This idea that you can simply say, well, we had a bad set of reforms, but there they are, they now need to endure forever, just doesn't make any sense. And I think everyone in the health sector actually agrees that this is something that really does need to be done. It's become far too complicated for patients and for professionals alike.
We'll talk about the funding in a moment, but Helen, last week Theresa May declined to act on a cross-party letter signed by 90 MPs, many of them Conservative MPs, calling for more collaboration on the future of the NHS and social care. Does she lack ambition?
I think she has ambition for the NHS. I think the Conservative government as a whole has ambition for the NHS. The problem with these calls for a cross-party way of working on it, whether it's like a royal commission, is this risks kicking it into the long grass, when actually this is a problem we have to address here and now, how we make sure we have a sustainable healthcare system, and particularly the social care challenge, which I think is really, really important, that we work out as a country the way that we fund social care and we achieve the coming together of health and social care. So it operates more like one system. And so you don't have that awful situation which I've had, and I don't know if you've had, with relatives ending up spending weeks, if not months, in hospital when they'd be much better off out of hospital at home or in a care home wherever they were living before, and instead they're ending up in hospital for weeks, and that simply isn't the right place to be.
So right now, the only plan that there is to muddle through without a plan, and that isn't good enough. So actually what wasn't mentioned in your package is that Lord Darzi is working with David Pryor, who was recently Parliamentary Under-Secretary of State for Health, actually Minister of State for Health in the Department of Health, under the current government, and Norman Lamb from the Liberal Democrats, and the report is going to be done by June. So actually an interim report on funding in March, to come up with a plan for the long-term funding settlement and a reform plan in time for the 70th anniversary. I don't think that's too long to wait or kicking it into the long grass.
Is it just about money, Gail?
I don't think so. I think there's a lack of confidence in the whole NHS workforce, really, that anybody has a plan. They've had a pay cut of 20% in real terms since 2010. The funding to the NHS is the least funding that it's ever had since 2010, 1% a year, compared with a 4% average. And morale is absolutely rock bottom. So we need some building blocks. One building block needs to be good funding, adequate funding, but another building block should be bringing social care into health, not more health into social care. Councils across the country have suffered 40% cuts at the same time that public health has been put into their domain, meaning that health visitors, much needed health visitors, are being cut. District nurses in some areas are being cut. So we need some strong foundations, some good building blocks, adequate funding, but importantly, consultation. Consultation with the staff, the clinicians, the people that keep our hospitals and community services running and consultation with the community, because at the moment 43% of all clinical contracts last year went into the private sector, and commercial confidentiality cuts out staff consultation about whether that's the right thing for patients and clients.
Well, let's go back to your first point about councils being stripped of so much of the cash that would have gone into social care. Was that a mistake?
Well, so I looked into this in my own local authority, Kent County Council, and actually since 2010 they've been putting more money into social care. So overall the budget for local authorities has been squeezed, but certainly individual local authorities have prioritised social care and actually increased the funding. So I think we have to be careful about being misleading. They've also increased the number of health visitors. So some of this is the priorities that councils are making.
I mean, the figures nationally are a 27% cut in social care at a time of rising demand. If Kent has bucked that trend, I'd love to hear more about it, but certainly the national trend is 27% cut in adult social care, whilst you've had rising demand. I don't think you can sustain the position, Helen, much as I wish you could, but somehow we haven't had these really brutal cuts to social care, and you can't fix the problem in the NHS without fixing social care. The reason for that is that any moment right now in the NHS, 30% of patients in hospital right now are medically fit to go home, but they don't have the social care packages to support them, to enable them to do so.
Right.
And not fixing that problem is...
No, I absolutely agree. I mean, in my own local hospital, we're having this conversation at the 30% point, that were we able to get this right and have patients who should be in social care receiving social care, we would have around 300 beds available for the people who...
But when Theresa May
Theresa
May mentioned and raised the issue of social care and how it should be funded in the manifesto, she lost her majority.
So the proposal in the manifesto didn't go down well, and I was sorry about that. But what I do think...
You supported that idea, did you?
So I supported us putting more money into social care and, for instance,
but the way it would be funded with the floor that was suggested.
So one thing that I think we have to look at is making sure that the whole cost of rising healthcare and social care doesn't all come from the income taxes of a working age population, who we know, for instance, are struggling to have the assets that people of an older age
But
are.
is that a radical way of thinking about it, Gail?
There's nothing wrong with a system. Everybody pays in and everybody gets out. The problem with social care is that councils are so strapped that they're paying into the care of vulnerable people £2 an hour. Now, that's not sustainable. In your own constituency, Helen, you've got care homes closing down. There is a broken model in adult social care. It's a business model, it's broken, and we've got to fix it. So we need a national care service.
One way of doing it is to ration what the NHS does. Would you support some drastic rationing in what was being offered?
I don't think that's the right way to go about it. I mean, as we were just saying, that we know that a huge amount of NHS resources are being used for people who could be having social care. I think the priority here is to fund social care better.
And what about paying for services?
Well, the NHS is already being rationed, let's be clear. So what waiting times are is a method of rationing. So waiting times are rising in the NHS. They're rising for planned operations, they're rising in A&E, they're rising for GP appointments, and all of that is a form of rationing. So how do you restrict the amount you spend? Well, you make people wait. So that is already a form of rationing that is underway. There are other forms of rationing around access to advanced treatments and therapies that are also happening at the same time. So rationing is already here.
And mental health.
And mental health services have been hugely cut.
On the floor.
I mean, absolutely.
All right, and on that basis, we have to end it. But thank you both very much. It's not just the NHS that's under pressure for more money.